Hello, and welcome to another episode of The Cougar, the Bitch, and the Wardrobe. I'm your host, Lana, also known as Curated by the Cougar. And today I'm really excited to be recording the podcast from the DRIPBaR Montclair here right on Bloomfield Avenue. And as a resident of Montclair for the last 8 years, I couldn't be more excited to see this new business here starting, flourishing, and growing an amazing client base. So I would love to start off first by introducing Jay. He is the owner of this brand new DRIPBaR location. So welcome to Montclair.
Thank you, Lana. Really happy to be here.
And thank you so much for allowing me to do the podcast from your beautiful location.
Absolutely. Anytime, you're always welcome.
Thank you. And of course, I found this beautiful top on Zara to match the wall.
Amazing.
So, as I like to do things. So we'll get into it a little bit here. So, as you can see, normally I record the podcast from my closet. I have stepped out into a new location, and we're going to explore what it means to get a drip. And for those of you who have experienced it in other locations, please listen and pay attention to maybe the differences that go on here. And for those of you who have never done one, this could be the beginning of a brand new, exciting venture into your health and wellness. So, Jay, if you would tell me what inspired you to open the DRIPBaR in Montclair.
So I've always been into health and wellness, and we want to explore different options. We're into healthcare. We have childcare as well too, and I want to see what else we could do to kind of elevate our health. And this concept isn't new, but people here in the East Coast are really beginning to embrace it and starting to realize what the benefits are of IV therapy. I wanted to explore different horizons and bring something to Montclair, which you can really use, which is of quality.
Amazing. And how would you say that the DRIPBaR is unique in Montclair? Because as it started to gain popularity, there are other locations, not DRIPBaR, but other drip venues.
Right. So what we have here is very unique compared to what other places would be doing, and we have a huge space here. It's brand new. We have a lot of services that we offer, which is the red light therapy, the boot compression. Our lab is very unique. Not a lot of places do this. We have very sanitary lab.
Amazing.
It's unique in a way that not everybody gets a system that we have, where we kind of make the vitamins there, the drips there, the B12 shots. Everything is done in a safe environment.
That's super important.
Yep.
Cleanliness, everything. Doesn't make sense to get a health drip if it's not clean.
Exactly. And we look after that a lot.
Yeah, that's great to hear, because I know there's so many concerns, obviously, especially in our post-COVID world, to keep sanitary, keep things clean, and to maintain good health. Why do you think that IV therapy has grown so much in popularity?
Well, you mentioned COVID, and a lot of people after that became very health conscious. People who weren't did start to look at, okay, what do I do to take care of myself? What's the best way to take care of myself? And IV therapy comes to mind.
Yes.
And the way it's delivered to your body, it's really efficient.
Yes.
You're getting a lot more than your regular oral vitamins.
Yes. And maybe you could speak to that a little bit, because I think it's important for our audience to understand, because over the years, people have become more health conscious, more health aware, and the supplement industry has boomed, that, people are on taking 20 different pills, powders, this, that. But what is the benefit of getting a drip versus a supplement that you might ingest?
So supplements, usually, you're orally taking them. Usually it's about 20 to 30% that's absorbed by your body, versus a drip, it's almost 100%.
Yes.
And that's a pure form of delivery to your body. It's right in your bloodstream. You'd start to feel it pretty much immediately. The thing with IV therapy is that you have to be consistent with it. You have to do it pretty much every month, twice a month, or 3 times a month if possible, to really gain the benefits of it. And
Yes.
it's a better form of delivery to be specific.
Yes. I mean, that makes sense. I mean, anything obviously that we want to reap the benefits of, we have to stay consistent with.
Yep.
So we don't want to just go to the gym once a month. We want to do a little bit more than that.
We want everything right away, but you have to be consistent.
Yes.
Yeah.
And in my previous career, I do have a master's in nutrition and exercise physiology. And when I was working with clients and helping them on their goals for nutrition, I remember having these conversations about this supplement, that supplement, how many supplements should I be taking? And then at the end of the day, I said to them, you know what, you're just going to have really expensive pee. That's what's going to happen because your kidneys are really going to filter most of it out. Your digestive system can only absorb so much into your bloodstream.
Exactly. And a lot of it just goes to waste, like you're saying. You're just going to end up taking it out because your body won't absorb it.
Yes. And could you speak a little bit to the different types of drips that you offer here and how they can also be customized depending on where someone is in their journey, what their specific needs may be?
So what I like to say is that we have a drip for everything. Depends on what you need. We have trained nurses here. We have a medical doctor as well too. We get advice from them as well. You're more than welcome to come for a free consult with our nurse and kind of let them know your needs. But we have drips for athletes. We have drips for diabetics. We have drips for women who are menopausal. We have drips for your skin. You name it, we probably have a drip for that. And that's what I really like about DRIPBaR is that we're able to really curate them for anyone who's there.
Yes. And do you find that there's one or two drips that people really gravitate towards, or they're ones that are the most popular?
So we have a power pack. That's pretty much for all your energy. We have an all-star drip. We have a lot of gyms around here, which a lot of athletes come to us. A lot of runners come to us. It's an all-star drip. We also have the debut drip, which is kind of your Myers cocktail. It's for the night after when you're partying. You want to come in and you want to hydrate. We have that as well too. So those are pretty popular. But then we can get really specific into what you really want. You can speak to the doctors, you can speak to the nurses, and they'll really guide you on what you should be doing.
Selecting the one that makes the most sense.
Yes. And we have programs as well too, where they're like a month program, 2 month, 3 months program, where you just consistently follow it.
Yes.
And you'll see the benefits after doing a couple of drips.
And how do you ensure safety and quality here? I mean, we're going to take a little tour a little bit later on of the lab, but if you could speak to that a little bit.
So number one thing is all of our staff, they're fully trained, they're licensed, RNs, registered nurses. And then we have a corporate medical director as well too, which oversees everything that goes on. So the minute you walk in, you're in good hands. You will be guided by the nurse and then followed by a consultation by the doctor. So if you tell the doctor, I have this issue, I have that issue, they'll recommend, okay, take this drip or don't take this drip. They'll guide you on what you need. In terms of safety, you'll see the lab. What we practice, hygiene is number one key. We practice a lot of the sanitary practices as well too. We wipe everything down after each and every single drip.
Yes.
Also, we take privacy into account as well. We have private rooms which we offer the clients as well too.
Yes. That's great. I think everyone feels a little bit differently about their wellness journey, and they might feel a little bit tentative about starting something new, unclear, just being able to have that.
We have a lot of patients or clients that come in that are cancer patients.
Okay.
So they want to be sometimes in a private room.
Yes.
So we offer them private rooms, and where they can kind of enjoy the drip on their own.
I think that's a wonderful option to offer someone. And are there any misconceptions about a drip that you'd like to clear up for my listeners?
It doesn't hurt.
Okay, that's a good one.
That's the number one thing. People think it hurts. It's like a little pinch, and your audience or anyone listening, they're more than welcome to come try it out. We're able to give you a B12 shot, and you won't even feel it. That's the most common misconception, that it's gonna hurt.
Yes.
What it is that the needles are very tiny. Once they go in, you might feel a little pinch, then you're done.
Yes.
And our nurse will also explain what type of needles we use. They're actually not needles that stay in. There's actually needles that come out, and she'll be able to show you exactly what happens. And when you get a drip as well too, and you're gonna feel, okay, you know what? The needle doesn't stay in there. That's technology's improved.
Yes.
It's improved a lot.
I can speak from my experience because I did my first drip last week here, and it did not hurt at all.
Exactly.
And how have you been feeling so far? I hope that you have felt welcomed by the Montclair community.
Absolutely. Everyone is amazing here. They're very helpful. They're always welcoming. And that's what I love about Montclair.
Yes.
It's a diverse crowd here. We have people from all walks of life. A lot of restaurants here. It's amazing.
Yes.
If you're trying to go on a diet, it's not it's not the right place. This place starts booming, after a little while.
Well, you're so well situated here on Bloomfield Avenue, and especially that your ground level, people can walk by, and it's such a beautiful and welcoming space.
It is, absolutely.
Yes. Well, thank you so much. I know that you want us to chat with Erin, so I'd love to bring her on.
Yes, absolutely. Yes. Thank you.
Thank you, Erin, for joining us here on the podcast today.
Yes, thank you for having me.
Of course. And if you can tell us a little bit about yourself, your background. I understand that you're a registered nurse.
Yeah. So I'm a registered nurse. I've been in acute care for coming up on 7 years. I actually worked, I know Jay mentioned oncology patients here. I worked in inpatient oncology for a year, and then medical surgical for about 6 years. So getting out of the hospital scene was kind of a nice break coming here.
Yes. And how amazing to have someone with your expertise, work experience to have here at the DRIPBaR, and to be really sensitive and understanding to different needs and your experience with different patients.
Yeah, definitely. It's nice to, and they put it this way too when I was first coming on board here, but it's nice to have patients that want to come here.
Yes.
And this is a good day for them, and we get to kind of help them navigate some things.
That's wonderful. Yeah. So could you speak to a little bit about what your role is in the client's drip journey? Let's say from the minute that they come in through the door and now they're here for a drip.
Yeah, so we as our nurses kind of are their navigators throughout this process. So we take a comprehensive health history. We really talk to them about what their goals are with us. We talk to them about their lifestyle, kind of what they want out of this experience. And then we are able to monitor them throughout their drip, make sure that they're everything comfortable and they're feeling good. Like Jay touched on before, nobody should really be in any pain or discomfort here. That's not the goal. So we make sure everything is going smoothly. We monitor them before, after, and during. So we're kind of here for the whole ride with them.
That's amazing. And I remember when I was here last week, I also did a video chat with a physician. Mm-hmm. So when does that come into play? And why would someone need to do that?
Yeah, definitely. And again, it's something I think kind of puts us in a different realm than some other IV administrative businesses now. I don't know that every place offers that, which is really nice. And every new client that comes in gets what we call a good faith exam. So they're seen by an MD or a PA or sometimes a nurse practitioner, and they are getting a comprehensive health screen before we're touching them at all. So they really go through some boundaries before to make sure everything is above board with that.
I think that's really so incredible because sometimes we don't know how someone's taking an over-the-counter med or the prescription, and how even something that's naturally existing in a vitamin form can really interfere in a negative way.
Yeah, definitely.
Yes, and the patient may not be aware.
Yeah, absolutely.
Yes, because I know, like for example, this just patients that may be on a blood thinner, they shouldn't drink grapefruit juice. Mm-hmm. Yes. And I find that really interesting because you think like,
who would think? Yeah.
Who would think it's just grapefruit juice, but it counteracts the med in a bad way. Yeah. It makes your blood thinner.
Yeah.
Yes. Mm-hmm. Yes. Okay. I remember learning that back in the day. Yeah. So it's interesting. So I think that brings a whole other level of awareness that before you do anything, you want to make sure that it has been cleared with a health professional.
Yes, absolutely.
Yeah. No, that makes so much sense to me. And in terms of someone comes in and maybe not right away, but now they've come repeat. What are the immediate benefits do you find that clients notice post-drip? Maybe there is, I don't know, maybe right after the first drip, they feel something, an immediate benefit. If you could speak to that a little bit.
Absolutely. I mean, I like to think that our clients get a pretty immediate benefit. Of course, the longer you're doing it, the better. But we see a lot of clients immediately, or if not the next day, a lot of mental clarity, more energy. Even if they're just getting something as simple as a bag of fluids, you are going to feel better after it.
Well, it's amazing how many people are just dehydrated, and just the simple act of hydrating changes everything.
Absolutely.
Yes. That's, I mean, that is so powerful. And I'm assuming also that you must see seasonal trends. So in the winter, maybe people are looking more for an immunity drip. So is there things that you would suggest in terms of what season we're in?
Yeah, absolutely. We definitely have kind of a seasonal trend here. We see a lot of our flu fighter drips and our shield drips. So our shield we recommend for people who maybe could be possibly immunocompromised, and they're like, man, if I get a cold, it's really not going to be good. Or even just everybody who doesn't want to get the flu. So you can get the shield kind of to ward off illness, or you can get the flu fighter if you've already gotten sick and you're really not being able to kick it on your own. You can come in and get our flu fighter drip and kind of give you that extra boost.
So that actually sounds interesting to me, because I'm going to be traveling in a few weeks on a plane for 8 hours. And I'm someone that I rarely get sick except for when I fly.
Of course.
Right. And I find that it's the recirculated air, and then you're in the airport, and then you get on the plane and it's freezing cold, and you're sitting freezing for 8 hours. So is that something that maybe I should consider doing before travel?
Absolutely. We have that. The shield is always great. And we actually do have a drip benefited specifically towards travel called the Jet Setter. Which is a very similar concept to, like you said, you never know who you're sitting next to on the plane, where you're going depending. So we do offer the Jet Setter drip as well.
So can you also speak to a little bit for people that really don't know a lot about the formulation? So for example, like I'm just going to look at the menu here, and I love it. It has everything inside. But for example, when I came in last week, I was really looking at the All-Star versus the Time Machine. And what are the key differences? Like why would someone choose the All-Star? Why would someone choose the Time Machine? What are the differences that someone should consider when thinking about what they need?
Yeah, absolutely. And that's kind of what we do too when talking to people of what they really want their goal to be. And then we can kind of narrow them down. But the All-Star is great I always recommend it to our newer clients that don't really have a clear goal. Because it's kind of a blanket drip. The All-Star and the Power Pack has pretty much every vitamin that we offer in it, which is great because it kind of covers a lot of bases. Whereas the Time Machine's more so specific to maybe pre or postmenopausal women, or anybody who really is just trying to get a little bit more of a glow.
And what would be the key ingredients in a drip like that make that difference?
So biotin a lot of the time is in the Time Machine drip, as well as taurine for muscle regeneration, which is really great for cell regeneration in your skin, and just to kind of give you that glow overall. So that's more kind of a specific tailored drip versus the All-Star, for example.
And then also in terms of age, I'm assuming that this is really for people over, in general, a drip is for people 18 and older. I don't really think it's a place where people say, oh, my child needs hydration or something like that.
Typically, we are 18 and over. I do think we can take clients at 17 given specific circumstances with a parent. But typically 18 and over.
Okay, no, that makes a lot of sense. And after regular visits, so if you're seeing improvements, generally speaking, maybe right away, after maybe someone's been here for a month, 2 months, can you speak to any great transformations people can expect to experience or feel?
Yeah, especially after long-term maintenance. I mean, it just becomes part of your daily routine. We see people that it becomes just like getting a massage or getting a facial. You work this into your health and wellness routine, and you're seeing less energy crashes. If life becomes stressful, you kind of are already at a level where you can manage stress a lot better with more frequent drips. So yeah, we kind of see those long-term benefits, which is really awesome.
I love hearing that because I think especially for my audience that may be perimenopausal, menopause, postmenopause, that's really helpful because so many of the women that I speak to have a lot of, with that period in life, there's a lot of anxiety, sleep deprivation. So it's good to hear that with regular visits with a specific drip that they may see significant benefits.
Absolutely. Yep.
Yes, I love to hear that. And what about any potential side effects that people should be aware of before going for their first drip?
Yeah, I mean, the nice thing about this is at the end of the day, it's a very quick in and out. There really are not a ton of side effects. We do have some drips that are more health style drips. So sometimes there are specifically our NAD and our NR drips. Sometimes the client can have side effects. Like I said, that's why they're cleared by a medical doctor beforehand. But typically, the only side effect you're going to get is a little bit of bruising from the needle that comes in and out of your arm. We do suggest that you have a little bit of water and a snack before you come, just because sometimes people don't do great with needles, which again is to be expected.
Of course.
But typically, as long as you're getting a lifestyle drip, we offer everything, like Jay touched on before, very sanitary, very professional. So really there should be no side effects at the end of the day. And
any advice for a first timer? You said to have a snack, to drink water, anything else? Should someone not work out before a drip or immediately after? Anything that someone should know?
Yeah, I mean, honestly, no. Like I said, have a little bit of water, have a little bit of snack. Again, come knowing you are going to get a needle in your arm. So that is part of the expectation. And then really come with questions. Come with your expectations set. Know what you want, because then that helps our job, and we can kind of make sure you're getting what you want out of this. Because at the end of the day, you are spending money. We're here as a business as well.
Yes.
And a medical professional. So we really want you to get what you want out of the experience.
That's wonderful to hear. And for someone who's coming here for their first time, how long can they anticipate that they'll be sitting for a drip?
So if this is their first time walking through the door, I would anticipate at least an hour, just because you do see our physician. So sometimes they're very quick to get on. It's a phone call via the iPad. So that's typically about 5-10 minutes, depending on how many questions you have to ask them. We get you set up with your IV inserted, and then your drip, if you're getting a 500 bag, which is our standard size, about a half hour.
Okay.
We do offer larger 1,000 bags for some extra hydration, which is always good. And that would be about an hour.
Okay.
So if you're a repeat customer, it could be a little quicker because you don't have to go through that health exam.
Sure.
But yeah, I would say about an hour and a half.
Yes. And for my audience, you're going to experience me getting my drip, and you'll see it's a beautiful space. I was here last week. I had my headphones on. I was listening to a podcast. These chairs recline. I believe, do they massage also? I forget.
They don't, but they're heated.
They're heated. They're heated. And it's just very relaxing, very zen in here. So I think this will be a great moment. Then we'll take a little tour of the lab.
Absolutely.
Thank you. So I'm here with Lydia. She is the manager of the DRIPBaR Montclair.
Yes. Hi, everybody.
And we're going to get a tour of the space now. So please take it away.
Come with me. I have the lab here. So this is where we compound the vitamins. We put all the vitamins into the bag. Make your own little cocktails and things like that. So if you just come, I'll show you how sterilized it is as well.
I'm going to move out of the way.
Yeah, absolutely. So if you take a look over here, this is our hood. This is what's very rare, and this is what makes us very unique. It's very sterilized. This gets cleaned at least 2 or 3 times a day, and then once a month we do a lot of changing with the filters and everything. This is our sterile cycle, so technically my nurse here, she'll explain, but we take the vitamins we're going to be using for the day. We have each pack and what they have in it, and here's where they do the mixing. So if your IV pack is taking anything more than 3 vitamins, this is where you're going to be doing it. Anything more than 3 vitamins, it has to be in the hood. And regardless, even if it doesn't, our nurses love using the hood, so they do it anyway in the hood, and it stays sterilized.
So it's really just to keep everything sterile.
Absolutely, yes. And these caps help with that, these gloves, and just the air in it with the chamber itself, everything gets sterilized, the air pressure as well. But yeah, so this is the main part of this lab. This is my favorite part of the lab, but everything else, as you can see, it's just our catheters, our needles, our fridge for our refrigerated vitamins. Like we have our glutathione that's refrigerated, our NAD, which you've experienced recently, right?
Yes.
I think Tri-Immune Boost is also in there. And then everything else is room temperatured, all the other vitamins. But yeah, we have all of our standing orders, so our nurses know exactly what's going into the IV.
Yes.
And again, if somebody wants to do their own cocktail as well, we have those too, so we know what to administer and how much of a vitamin can go in with the other vitamin, if that makes sense.
Yes. Amazing.
Yeah. And then we have a lot of procedures that we follow, a lot of logging, a lot of documenting in here. This is like our chamber of IVs.
So there's a very specific protocol that's followed.
Yes, and everything is accounted for, all lot numbers, everything, all of our vitamins, down to the hot packs and cold packs. We have everything logged in.
Incredible.
Yeah.
Incredible. Thank you.
And then we also have red light therapy and boot compression, and I'll show you what that looks like as well.
Yes.
Over here, we have our red light therapy.
I'm going to go this way. Yes.
Yeah, so a lot of people who are waiting for their... Yeah.
I love it.
Oh, yeah. People get naked in here. Let me tell you. Well, the door's locked. You know, I just want to make sure that everybody knows they're not getting walked in on.
How do I look in red lights?
How do we look? Good? Does my jacket look red still? But yeah, so people come in here, they get, fully derobed.
Yeah.
Because it's best when, it's touching your skin.
Yes.
And I tell people all the time, I'm like, even with your eyes, it helps your eyes. I mean, we
Incredible.
do have goggles because some people do have sensitive eyes.
Yes.
But yeah, hair, skin, scalp, everything.
Yes.
So,
because as I mentioned the last time that I was here, I'm starting to train for Hyrox. And so in terms of inflammation for athletes that you experience during intensive training, red light is great. And then also the compression boots.
Oh, absolutely.
With circulation, it's so helpful.
Especially people who are like concerned with that inflammation.
Yes.
If you get a glutathione drip and you get this done, you're good.
Sign me
You're
up.
good for a good month.
Sign me up.
At the
I love
very
it.
least, yeah.
I love it.
So this is, I'm going to turn this off so we don't get blind.
Yeah.
And then here's our boot compression therapy boots. Lana, do you want me to demonstrate on you?
Sure.
That would be cool, right?
All right, let's do it.
Let's do it. All right. So these are great for blood flow.
Yes.
Actually, they.
I did it last week, and I really did like it because I do get a lot of. No one look at my socks. I'm just wearing white socks. They're not sexy. Not
when
that
are
everything.
Socks ever sexy?
They're never sexy.
I think I have a pair of Nike socks on that are just like
they're never sexy.
my athletic socks.
Yeah.
Nobody would know under these very nice boots.
Yes.
Okay, so here is our boot compression.
Yes.
So we just slip these on you, and mind you, this is like as if she's the client. So I'm here. Don't be scared. I'm not scared of feet. I think Victoria is, but we're all good at that. So slide these on. And then what this does is it helps your blood circulation. It helps your blood flow. So if you're getting this done while you're getting your IV, it's like...
Which was what I did last week. So it's great. So you get two things at the same time. You're out of there. You've done your legs.
Exactly.
Yes.
Like if for people who do runs, like if they're runners, they do marathons, doing this pre and post that marathon is the best thing you could do for your body.
And I also think that... what we were talking about earlier about prepping for a flight, because I also get very bad leg cramps in a flight.
This would help with that. This and our jet setter. We have a
jet that's what
setter,
we chatted about. So I think I'm going to do that.
Filled with vitamin C, which is amazing because you don't know what people have on that airplane either.
That's exactly what we were talking about.
Here, so let me turn this on. And then with this machine, this is all left to the client. So whether it's too much pressure, whether they want to lower the time, they want to start it up again. If they're, it's not enough time.
Yes.
This is all theirs for that IV.
I love it.
Over here, this is where the client would be able to, have their customized settings. So let's say they want more time or they want less pressure, more pressure. This is all done here and this is left with the client. We monitor as it is. We start it up. You'll start feeling the boots inflate. And yeah, it's kind of like a deflate, inflate kind of thing. It's like a blood pressure cuff.
It's so amazing.
Yes, it makes you feel amazing.
All right, I'm definitely going to do this while I do
your drip
my
today?
drip. Yeah.
Let's do that.
Yes.
Okay, so let me help you.
Perfect.
Let me get rid of that. So this is our consultation room. This is where typically after they fill out their forms, or if they want to fill out their forms in here, they're more than welcome to. Here, let me just open it this way.
Yes, thank you.
And then, so here is this little room, and we have another room similar to this one that is for members only, or we'll use it to, if somebody's actively sick. We don't want them in our main drip area, so we'll give them that room so they're secluded. We disinfect that area, making sure that nothing spreads, obviously. But yeah, so here's where you'll be doing your consultation with the nurse.
Great.
You'll meet with the doctor.
Yes.
You know, any questions or concerns, they usually answer for you.
Okay.
And then this is where you get staked.
Yes. Okay,
so
great.
Everything happens in privacy. We don't like anything being exposed.
Perfect.
We don't like people feeling exposed.
I think people feel so much more comfortable knowing that they have privacy.
Absolutely.
Yes.
It definitely changes the environment for a person to be in privacy more than
great.
out in public.
Great.
So, but yeah, so I'm going to go ahead and get Erin.
Yes, so I
know you want to get your drip today.
Yes.
So I'm going to go ahead and grab her. And
Okay.
then, here's a menu if you want to take a look.
Thank you.
At some stuff we have.
Yes.
And then I'll get her.
Thank you.
Yeah, no problem.
So I'm looking today and I'm thinking about doing the time machine with a glutathione push. So can you tell me a little bit about the benefits of the time machine? I think we might have chatted briefly about it, but just overall, what can I expect as the benefit?
Absolutely. So you're going to have a comfortable drip with, which is the benefit of all of our lifestyle drips. You're not going to have any side effects, which is great. And then in the time machine, it's got a high dose of vitamin C. It's got some really great components that are really going to make you feel glowy on the inside and outside, which is always a benefit.
Yes.
And then the glutathione push, I cannot recommend enough. We actually, I would say 90% of our clients that come in do get that glutathione push. It works at a cellular level to really detoxify your body, specifically your gut health and your liver. It really aims to detoxify, so which everyone can.
That's amazing because Wednesday night I went to an event and I had a few too many glasses of champagne.
And that's what we're here for.
Wonderful. Okay, great. So let's do that.
Awesome.
Great.
So right now I have our normal saline bag in our chamber here. This kind of just purifies anything that's going into our sterile hood. I'm going to insert my hands in here, and then we're going to get all the vitamins mixed into our bag. All right. So our 60 seconds is up. So I'm going to grab our clean saline bag now and bring it into the hood with me. All right, and our client wants to do a time machine drip. So I'm going to pull up how much vitamins is going into each of her bag here. We have these little cheat sheets, which are very helpful. Okay. So I'm going to start by pulling up her vitamins. She gets 2,500 milligrams of vitamin C. And then we inject this straight into the bag. And then she gets 600 milligrams of magnesium. She gets 1,000 micrograms of B12. She gets 100 milligrams of taurine. And then last but not least, she gets 1 ml, which is 85 milligrams of vitamin B6. Okay, and that's our time machine drip. So I'm going to get her IV started. We're just going to put a tourniquet around, which can be a little bit uncomfortable. It is a little tight, but non-painful. Okay, relax that arm. Take a look here. And I'm going to clean her arm off with some alcohol. And I'm going to give that a minute to dry and prep my station over here. A big misconception is that people think that the metal of the IV, the needle, stays in your arm, which is not true. I'll show you guys too. It comes right out. So it is a big pinch to start. but the needle does come out, which some people think it does not, but it does. I can show an example too after, but this is the needle that goes in. As soon as I remove, there's a thin plastic catheter that's going to leave in her arm. The needle comes out and gets retracted out. All right, my dear, big pinch.
I want to thank my listeners for joining me today at the DRIPBaR Montclair. For those of you who are tuning in for the first time, thank you so much. Your support and listening to the podcast really helps the podcast grow. And if you know of anyone who might be embarking on their wellness journey, please share this episode with them. You never know who you're reaching, who you're helping. And if you have any questions at all, please feel free to reach out to me on Instagram and on TikTok at Curated by the Cougar, on YouTube at Curated by the Cougar. And you can find the podcast on Spotify and on Apple Music at The Cougar, The Bitch, and The Wardrobe. Please reach out to DRIPBaR. You can find them in Montclair at 608 Bloomfield Avenue. And in the captions, I will include their contact information. Thank you so much for joining me, and until next time.